The healthcare community's fight against cancer is leading to increased survival for patients, which is encouraging to hear. However, it's important to recognize some problems that can arise when a patient with cancer lives longer. Dr. PK Morrow, an oncologist and the executive medical director of global development at Amgen, explains one such problem. What can happen after cancer spreads from a solid tumor to bone?
Cancer can spread to different portions of the body, but bone is a common site. Generally speaking, all cancer patients are at risk for cancer spreading to the bone. However, patients with breast, lung, and prostate cancer are at a higher risk for cancer spreading to the bone.
When cancer from a solid tumor spreads to a bone, this is called bone metastasis, or bone met for short. Dr. Morrow explains.
A bone metastasis, or a bone met, is where cancer cells spread from the original solid tumor to live in the bone, where they can cause serious bone problems. That's very different from bone cancer, where the cancer cells originate within the bone itself. Bone mets can usually be confirmed by a bone scan. Bone metastases oftentimes spread to the center portion of the body, which includes the skull, the upper arm, the ribs, the spine, the hip, and the upper leg. Bone metastases can cause serious bone problems, which is why we need to spot them and discuss them as soon as possible.
Serious bone problem is a term used to describe certain troublesome events related to patients' bone health that can occur when a bone met is present.
Serious bone problems are broken bones, a need for surgery to prevent or repair a broken bone, a need for radiation to treat bone pain, or spinal cord compression, which is described as pressure on the spinal cord, can result in decreased sensation or impaired mobility.
There are certain troublesome events related to a patient's bone health that can occur when a bone met is present. Dr. Morrow describes some of the problems for us as well as some of the telltale symptoms to watch for.
Worsening or new bone pain can be a sign of a serious bone problem. Numbness or weakness around an affected bone, or even bowel or bladder control changes. But there are other symptoms, which may include sudden severe pain, pain that prevents you from moving, pain in your back or neck, difficulty urinating, constipation, lack of bowel or bladder control, numbness, weakness, paralysis.
Many early-stage cancer patients say that their diagnosis came as a shock and that they have not experienced any symptoms at all.
Patients can have bone mets, which can lead to a serious bone problem without even experiencing symptoms. For example, a patient could have a bone metastases that can lead to serious bone problems without having any bone pain. That's why if patients are concerned about bone problems, they should talk to their physician about their risk of bone problems and whether they'd be appropriate for a bone scan or another imaging test. Bone targeting medicines, or sometimes called bone targeting agents, can help to prevent serious bone problems. Bone metastases impair the body's ability to rebuild bone. What these bone targeting agents do is they help to restore that balance. These agents are given every 3 to 4 weeks by intravenous infusion or injection. As with any medication, there are potentially serious side effects. These bone targeting medicines can cause dangerously low calcium levels, also called hypocalcemia. Your doctor may recommend calcium and vitamin D supplements to help prevent the side effect. In addition, osteonecrosis of the jaw, which is bone damage in and around the jaw, can occur in patients taking bone targeting agents. Patients can also experience unusual thigh fractures. Proactive treatment, if you're at risk, is extremely important. Talk to your doctor about your bone health, about whether you should get a bone scan, and whether taking a bone targeting agent is appropriate. Studies have shown that without a bone targeting medicine, patients with bone mets may experience a serious bone problem within less than 1 year.
Thank you, Dr. Morrow, for all of the insight. I just want to take a moment to acknowledge the friends and family who stand by patients in their fight against cancer. As a source of encouragement, caregivers offer unrelenting support in so many ways, such as going along with them to appointments, asking nurses and doctors about topics like bone health, or simply being there. So we say thank you. And for more information, you can visit us at accesshealth.tv.